Evaluating the Importance of Patient Education by Samantha Sodders. The nursing problem that we will talk about today is patient education. Patient education is an essential part of all professions within the healthcare sector. It can be considered a vital part of appropriate nursing care. Successful patient education has an effect on the health of patients and their family members. What is the significance of patient education? Well, good quality patient education may be understood to consist of several different factors, such as patient education resources, implementation, sufficiency, and effects. Without efficient patient education, patients are at risk for medication noncompliance, increased pain management issues, frequent readmissions to hospitals, and inpatient falls, just to name a few. The basis for the implementation of good quality patient education is patient-centered, which includes taking into account the patient's need for the education that concerns information and support. The interaction between the healthcare personnel or provider and the patient has a very crucial role in the education process. Significance of patient education continued. The interaction refers to situations where healthcare personnel encourage the patient to participate in discussion and offer the patients an opportunity to ask questions and to give feedback. Regardless of the patient education methods that are used by healthcare personnel, patient education should fulfill the patient's needs and be understandable. Many times, patient education is rushed and the patient doesn't really have time to fully comprehend the information that is being given to them. This being said, education is a critical part in the health and overall well-being of the patient. Patient education and medication compliance. It has been recognized that older individuals are at greater risk of polypharmacy, and the management of their medications is more complicated as a result of this. Inadequate verbal or written instruction by the pharmacist or on the medication labels can result in noncompliance with dosing and administration regimens. One study that was reviewed aimed at determining the type of information that patients received when they collected their prescriptions, and whether this information was misunderstood or any information was missed. The development and evaluation of appropriate patient education material and methods of delivery suitable for older people would allow pharmacists to ensure compliance among this potentially vulnerable patient group. Patient education and falls. The effort is ongoing to evaluate the effectiveness of hospital-based fall prevention interventions. The inconsistencies in fall interventions could be due to staffing being unable to recognize the importance of some fall prevention interventions in patients' risk factors for acquiring fall-related injuries. Multifactorial fall prevention intervention programs could reduce falls and fall injuries in hospitalized patients. This includes staff and patient safety education, fall risk assessments, patient fall risk alerts, environmental and equipment modifications, medication management, and assistance with transfer and toileting. The education process is not only important for the patient, but is also very important for the healthcare providers that are caring for the patients. An implementation plan for patient education. Effectively meeting the patient's educational needs, as with the delivery of any aspect of quality of care, does not happen by chance. Rather, it requires planning. The process of education can be formalized by applying a strategic planning model for patient education. The following are considered an effective patient education system: continually updated information, consumer-clinician partnership and learning, on-demand use of interactive technology, appropriate material for diverse patient populations, coordination across the continuum of care, alignment with regulatory requirements, and standardized information balanced with the individualized educational needs. Barriers of patient education. Communication. The need for effective communication skills is particularly prominent during inpatient nursing assessments when nurses identify the patient's presenting concerns and difficulties, which directly informs their future care. Effective nurse-patient communication enhances the patient's understanding of their diagnosis, prognosis, and decision-making about future treatments, thereby facilitating good patient care planning, patient education, discharge planning, and timely patient outcomes. Communication difficulties encompass lack of empathy, lack of respect for patient privacy and confidentiality, use of medical verbiage, giving unclear, inaccurate messages, and misunderstanding. Effective communication between patients and their healthcare team improves adherence to treatment recommendations, emotional and physical well-being, and satisfaction for patients and their healthcare provider. Barriers to patient education. Health literacy. The busy healthcare setting often makes it hard to find time to do all of the essential teaching that a patient needs. We often compensate for this lack of time by sending patients home with instructions or educational materials to be read. There is a growing concern of much of the educational material being sent home with patients cannot be understood. Difficulty reading can also lead to low health literacy, the ability to understand and use information that is important to stay healthy. Patients may not be able to read the information sent home with them that describes their disease, the medicines they are taking, and important facts they need to know, which means they will not have the essential information needed to help them get well or stay well. We can help patients be more compliant by giving them materials they can easily understand. What are the elements of practice that need to be changed? First, we need to design a process for identifying patients with high risks. Through a program of patient education and training and self-management skills, improvements in health outcomes can be achieved. 2. Provide access to information and help when it is needed. Patients are more likely to seek and pay attention to information when they need it, that is, when they are ready to receive and use the information. 3. Adapt patient education to the needs of the individual. Patients are no longer satisfied with receiving commercially printed educational materials on their health condition. They are more interested now in normal ranges of labs, for example, and plans that are tailored to their specific needs. 4. Take advantage of available technology. There are computer databases and software available that can improve patient education in a variety of ways, including customized handouts. 5. Make patients partners in managing their own health. Patients are now evolving into active participants in making decisions about treatment alternatives and managing their health status. And 6. Organize to implement patient education. As health maintenance has shifted to ambulatory and home care, responsibility for patient education has expanded beyond the primary physician and nurses to include their health professionals, specialists, patient educators, and even family members. A number of trends are causing patient education to become increasingly dispersed, requiring high levels of coordination. Those involved in a patient's care will need to communicate and work as a team.